Dr. Brittany Montross is a vascular surgeon at Millard, Fillmore, Suburban Hospital. She joins us today on Medically Speaking. Doc, thanks for being here today.
Thanks for having me.
Welcome to Suburban Hospital. If you can, tell us a little bit about your background and how you ended up coming here to Buffalo.
Oh, I actually am from Buffalo. I grew up in East Aurora and have lived here pretty much my whole life. I went to UB for undergrad as well as got a master's there and then did medical school through UB. I graduated in 2015 and then I stayed for an integrated vascular surgery residency. And basically what we wanted to do was kind of expand our coverage to Millard, Fillmore, Suburban and give the people in the North Towns a little bit more access to vascular surgery that previously they would have had to go downtown to do.
That's great. If you can, for the viewers, though, let's start with the vascular surgeon and what vascular surgery itself is, if you can explain that.
So as a vascular surgeon, we treat vascular diseases, and we do treat them both medically as well as with surgery. So vascular disease, basically vascular means blood vessels. So we treat the arteries and the veins in the body. And basically we treat, as a vascular surgeon, any vessel that's outside of the heart and outside of the brain. And then kind of what we treat when we talk about arteries and veins is blockages or clots, dilations, which are called aneurysms, with the abdominal aortic aneurysm, or some people have heard of AAA being kind of the most common area for aneurysms, or tears in the vessels, dissections.
So I know we joke about it from time to time about Western New York and chicken wings, but Western New York and upstate New York in particular has a higher prevalence of vascular disease. A lot of it's related to the sedentary lifestyle, weather, diet. If you can, tell us a little bit more about Western New York and what makes it unique when it comes to treating vascular disease.
So, I think in general, the jokes that we make about Western New York and chicken wings and things like that are kind of true. In general, the kind of risk factors that predispose people to vascular disease, genetics are huge. You can't really fix that though, but high cholesterol diets, those kind of things really do predispose people to vascular disease. Hyperlipidemia, the poor diet that people here have, also goes with diabetes. All of those things kind of affect the vessels. The same things that you think about for heart disease, that you worry about for that, it's the same blood vessels that are affected that we as vascular surgeons treat as well.
Walk us through a typical conversation with a patient who may end up being referred to you, who is suffering from vascular disease. And if it's not taken care of, if that surgery isn't performed, how serious that can be.
So as a vascular surgeon, we kind of treat a lot of different diseases. Some of the common ones would be like a peripheral arterial disease where patients can have pain with walking, and that's kind of the lowest end of the spectrum, whereas as it gets more serious, people have pain in their feet all the time. And then also they can have wounds. So that's obviously the most concerning, and that's where you get concerned that people can have gangrene or lose their limbs if they don't have some kind of treatment done. And the first treatment is changing your diet, watching your cholesterol intake, taking your aspirin and statin as prescribed, but ultimately those patients probably will need a surgery too. Smoking is also huge. I don't think I mentioned that before, but people that smoke are at significantly increased risk of having vascular disease. And again, that's, the blood vessels in the leg that can cause, wounds on your feet, the blood vessels in your neck, the carotid artery, which can cause stroke, which we know is pretty prevalent in Western New York as well. And then other things like the AAA or the abdominal aortic aneurysm that we talked about, people with that, there's some genetic component, but smoking is huge for that as well. And that is really a life-threatening thing. If that ruptures, your chance of dying is very high.
So as you went through school, I'm sure you were familiar with the Gates Vascular Institute, but if you can explain a little bit more about the impact of putting a facility like that online, and how through Collida Health now we're growing a program at places like Millard, Fillmore, Suburban.
So having a place like Gates Vascular Institute for the region is huge. What's really special about it is that, there's vascular surgeons there, there's cardiologists there, there's neurosurgeons there, all who kind of work together to treat these patients, because again, it's all the same risk factors. And so our patients have a lot of the conditions. So my patients will have heart disease, they'll be at risk for having strokes. And what's really nice about that facility is we kind of all work together. If I'm doing something for the leg and they have a heart attack too, the interventionalists are right there and can help us out, and vice versa, which is fantastic. And what we're kind of trying to do with Suburban is a little bit of that as well, and to kind of expand the coverage there. So we won't have that same, everybody in the same place, but we make those connections. And then, you always have people to call. And when we need to transfer somebody downtown, the way to do that is pretty easy because we have those strong relationships.
Sure. You're a Western New Yorker, so you've seen the evolution of a place like Millard, Fillmore Suburban Hospital. Maybe talk a little bit about how that facility and that location really has evolved from a pure community hospital to a place now that offers vascular surgery.
I think the care there now is pretty fantastic. They do a lot of surgeries there as it is, but it was kind of more of a community hospital. But I think it's a really important large hospital that we need to have all these different specialties at as well. As a Western New Yorker, I know in general people kind of like to stay in their own regions. So I grew up in the South Towns, and the city was a big scary place when I was younger, and it's easier to travel now, but a lot of people in the North Towns still don't really like to come into the city. It's hard to park, those kind of things. And so I think increasing the services that are available there, which they're doing, is really going to help the people in the North Towns.
As a vascular surgeon, when you're finished up with school and all your training, you probably had a chance to really pick the spot you wanted to go to, probably anywhere in the country with that type of specialty and niche practice. What kept you here in Western New York? What drew you to, working with the university? What brought you to Suburban Hospital?
I wanted to stay in the area. I think the Buffalo in general is a fantastic place to be. So I definitely wanted to stay here, and I really was fortunate to train with some great people who are doing really cutting edge vascular surgery, and then to join them for the practice is kind of why I wanted to stay, to kind of continue learning from them through the early years of my role as an attending vascular surgeon. And then, for Suburban, like we said, it's a really big hospital that has a lot of patients that still have those same needs as the people that have to come downtown, and offering it without having to transport those patients is going to be really important for them, especially for the big emergent things that we need to do. The time delay to transfer somebody downtown who's already in a hospital just seemed like, it was hindering the care a little bit.
Dr. Brittany Montross talking about vascular surgery and bringing care to the North Towns community. Thanks for joining us today on Medically Speaking.
Thanks for having me, and have a great day.